Hello, everybody. Welcome to another episode of Unnamed and Untamed. And we have a celebrity with us, everybody. I'm just going to start off with it is what it is. You've already seen who's on the podcast with the title. We have the one, the only Dr. Carrie Jones with us. Most people probably know her from Precision Analytical, the Dutch test. However, she has also worked with Rupa. She's an active practicing medical doctor. She is now working with MMU as well as Nutrition Dynamic. Carrie, I'm going to totally butcher all your accolades. We could probably go on forever, but would you be able to introduce yourself and how you would like our followers to get to know you if they aren't Carrie Jones fangirling you already, or as we've already recorded, our husbands and our boyfriends are fanboying you as well. Would you be able to introduce yourself to all those who aren't familiar with where you've come from, what you're currently doing, what you were doing previously, and where you're going? Because I know that's shifting too.
Absolutely. Well, first of all, thank you so much for having me on today because I can't wait to talk all things hormones, particularly estrogen, which is near and dear to my heart. I grew up in the South. I grew up in Lexington, Kentucky, of all places. And I've said this before, but my health education, or whatever you want to call it, was my high school football coach teaching us about how our bodies work. And in Kentucky, short of letting people know, like the P goes in the V, and that's how you get pregnant, or don't and don't, like that was the extent that I got. So I was ready to go into conventional medical school. I volunteered at two different hospitals. One was very clinical, pediatric. The other was very community outreach. I hated the clinical pediatric. It was so sterile. All the surgeries, the medications, I was grateful for it. That's not how I wanted to practice medicine, but I didn't realize it then. And the outreach is what I wanted to do. So I put medical school on pause, moved to Portland, Oregon, of all places. And there I found naturopathic medicine. So I actually became a naturopathic doctor, did my residency in women's health and hormones because I realized over and over and over again, so many of my friends, so many of my patients, just everybody female was like, I didn't know that's how it worked. I didn't know that's how our periods, I didn't know. I mean, I knew cycle syncing from back then. I have old books from when I came to Portland in 1999 that were dated long before that talked about cycle syncing. And I thought, why is this stuff not common knowledge? Why don't we talk about perimenopause? Why don't we talk about any of this? And that's what I did. I saw patients for years outside of Portland, started working for the Dutch test, got more into hormones at large, and have just continued it ever since. Went and worked with Rupa. Rupa Health is a lab platform. So I got really familiar with a lot of labs that play into hormones. And now I just do a lot of consulting, a lot of educating, a lot of travel. And I still work with Rupa and then also with Metabolic Mentor University and Nutrition Dynamic and New Ethics Formulations, which is an ecosystem supporting coaches, predominantly dietitians, nutritionists who are getting into functional medicine and really want to learn, from my perspective, want to learn hormones. So it's been so much fun watching on social media, watching podcasts explode about hormones, because good gracious, we need it. We need it.
Yeah.
It's like so many people didn't even know the word perimenopause. Like they didn't even know like they didn't realize stuff about PMS or PCOS. And I'm like, why is this not taught? This should be common. So I'm hoping like this and everything everybody's doing is spreading that word.
Absolutely. I think it's the education we all needed in high school. I think we all have that same health class teacher.
It never stopped.
I can't believe how many women I work with, and even myself, right? But at 40, 45, and they're telling me, I just never knew this about my period. I just never understood, something so simple like, oh, I'm gassy around ovulation. It's not a food allergy. You don't have to, why is it sometimes not other times? It's like, let's just track digestion around ovulation. And even just that, it can be, oh, wow, I'm just ovulating, just awareness into how to support yourself during different parts of your cycle, whether it be, L-theanine, chamomile tea, or chaste tree, or breath work, or just any of those things that can support how you're feeling in those different times. Because you're not crazy. You have fantasia going on with your hormones.
Yeah.
Every day it's going to be something different, you know? And once you kind of understand that and you can buckle up and ride with it, it's a really cool journey to be on.
Yeah.
Like you can really understand it. I know my boyfriend's always like, oh, well, you're right around ovulation. So it's probably not, you need to add more fiber and you just need more water. You know, like, wow, you're
Wow,
right.
Maddie.
You're paying attention.
Wow,
But
I know. I'm like, okay.
Yeah.
Good
It's
idea.
amazing to me, like even the wearables who are, you know, whatever you choose, a band, a watch, a ring, you know, there are a lot of wearable options out there anymore. But even in the start of them, the menstrual cycle is confusing and it's hard to incorporate. So a lot of these tech startup companies originally weren't even including the menstrual cycle or women into this. I remember in the middle of the pandemic, I happened to wear a ring as my wearable tracker. And not to knock this company at all, but it was a very male dominated, male created for males. And my temperature, you know, at ovulation, when you release the egg, your progesterone goes up and that's warming. So you go up about 1 degree. And if you don't know that and you're wearing a wearable and your temperature goes up in the pandemic, you're like, it got me. Like, here comes the fever. Like, this is what it is. And it's just you ovulating. So I would make posts joking about this, like, oh, my temperature went up 1 degree. Whereas men were tracking this and being like, oh, I could tell when I got the virus because my temperature would go up prior to me actually feeling sick. And I'm like, just over here ovulating. Like, I'm just over here being a physiologic female and seeing my temperature go up. And finally, the companies were like, oh, this is a real thing, and started including cycle tracking, started including period prediction, ovulation prediction, if they're, you know, if they're tracking that information. And I was like, y'all, it's 2021, 2022. Like, come on. I can't believe you didn't even think to pull this in. And now I'm seeing it a whole lot more, thankfully, because we're half the population. Like, we need to have this information and include it when we're doing our own health assessment, however that looks.
It's so cool to see how much data tracking, you know, whether it be an app or a device, has actually come out. I mean, even there's a new app, and I'm not like affiliated with them or anything, so just to be clear, but I like the app Clue. It's cool. It's great for tracking. I think it's really interesting to have clients kind of go through that data. But I always like to test things, and I just downloaded about a month and a half ago, or two cycles ago, the app Moody. And it is day by day. I highly recommend all three of you lovely ladies just try it, because it's really cool. So it'll be like, you know, day 3 of your cycle, try to get more cruciferous vegetables in. So it's got really cool, hey, you know, you're there might be a change in body temperature coming, prepare for, like, just walks you through how you might be feeling, and you can track your mood a little bit more. So it's not as much data as far as like cervical mucus, things like that. But as far as your mental health and your period go, it does a really good job of like helping you understand where your feelings might be around your cycle and how your physical body is feeling during those times, which I find really cool, because I didn't have that growing up. It was, you wear a patch, you get something injected in your arm, or you put a ring in you. And like, that was the only, and you just didn't want a period. That was like the goals. Like,
Oh yeah.
Right.
How many people here were told you don't need a period? You don't need a monthly period.
Like, you know, as an athlete,
Yes.
badge of honor. Yeah.
Yeah.
Exactly. Yeah. So, and then you know, I spent 5 years trying to get my period back. So it's funny how wow.
Well, and that's why we wanted to talk to you today about our friend estrogen, because it's definitely, I mean, we're going to focus on women today, but men and women like fear estrogen, and there's a lot of just fear around it. And I think that fear just comes down to a lack of understanding, like we've kind of been chatting about. So maybe kicking it off with what she does, both from a
Yes.
reproductive cycle standpoint, and then maybe even, you know, a little bit beyond that.
Estrogen, we have a couple of estrogens. So the one, when you hear the word estrogen out anywhere in the world, most people actually referring to the potent one called estradiol, or E2. But because there are a number of types of estrogens, we just umbrella it under the term estrogen. So if you are still cycling, in your ovaries, you have little follicles. The follicles what contain the eggs. And they are wrapped in 2 layers of cells. So you have an outer wrap, like kind of like, like a hard chocolate covering, and then you have the inner soft goods, and that's how you make your hormones. On the outer soft, or on the outer hard cells, you make androgens, testosterone, DHEA, androstenedione. They float inwards to the next cycle layer, the next cell layer, and that's where you make estrogens. So in your ovaries, you have to first make the androgens, then you make the estrogens. Those two types of cells, after you ovulate, magically, like Cinderella, turn into the cells that make progesterone. They become something called a lutein cell. So in your follicle, you make 3 different forms of hormone out of the same follicle, and they all precede each other and need each other to work. They have to be healthy, all the things. Now, you can also make estrogen out in your body. You can take those androgens, that testosterone, that DHEA, that androstenedione, and eventually we call it aromatize with an A, aromatize into estrogens, estrone and estradiol. So we make estrogens in 2 different places. Ovaries, for sure, big time, that's the main place, and then out in the rest of our system. Men are different. Men make their estrogen just out in their system, out in the fat tissue, out in the muscle from that aromatase. Now, estrogen, estradiol, changes in a cycling woman a little bit every day. It's on a very controlled roller coaster. It shouldn't be too high. It shouldn't be too low, depending on where you are in your cycle. And it shouldn't go off track. And that's where we get into all the like, oh, I hate estrogen, because it's completely gone off track relative to the other hormones around it. But estradiol is so important. You have estrogen receptors on almost every single cell of your body. It's super interactive and critical with your mood and your neurotransmitters and whether you make them or not. It plays a big role in your gut and the health of your gut. It plays a role with your immune system. Your immune cells change depending on like where you are in your cycle, or if you're transitioning into perimenopause or menopause, it impacts your immune system. It impacts your thyroid, your brain, your heart, your cardiovascular system, your bones, like whether you're going to develop osteoporosis or not, your skin, everything estrogen, almost everything estrogen plays a role in. And so when I hear people freak out about estrogen, I'm like, it's not actually estrogen itself as a hormone. It's the relation to everything around it. Is it out of balance? And then when we're done using estrogen, it has to go through a detoxification system. And if that goes off the rails, then obviously that can cause problems too. So at the top thing I want everyone to take home is that estradiol is touching almost every cell in your body, usually in a positive manner. And that's what we like. That's what we need as females to do the thing.
Would you be able to actually, for some of our listeners, they have a lot of fear around estrogen, and everyone is always hearing that we just need to get rid of it. And I think that right now you've really encompassed that. Everyone's like, well, Jesus, I don't want to stop all that. That's my brain's kind of important. I want to not break a hip. Where did the fear kind of come from? And I know that's a long question, but I think it's really important that we do cover for people where a large amount of fear came from, and perhaps where some providers are still kind of living in that, and no disrespect to them, because that's what they've learned. Like people were going through school during that, and they were just now, I think, kind of coming, up to this crescent of this beautiful sunrise going, but where did a lot of the fear come from?
Initially in 2002, there was a study called the Women's Health Initiative, the WHI. And what they were doing is part of a grander study, was to evaluate hormone replacement therapy on menopausal women. So they were looking at ethinyl estradiol, which is a kind of estrogen, and or ethinyl estradiol and a progestin, which is a synthetic or fake progesterone, and the effects on breast health, on the effects on bone health, on the effects on heart health. Like, I had multiple prongs to this study. And what happened, unfortunately, is that they took the data. Well, there was a lot of unfortunates with this study, like a ton. But what the media did was they globbed on to an inaccurate outcome of this estrogen. Estrogen causes breast cancer, and they stopped the study. It made national news, and all across the world, most women stopped their hormone replacement therapy and subsequently became extremely fearful of it, that it causes breast cancer. And it's taken 20 plus years to turn that cruise ship around. Many of those authors, not all of them, but many of the authors of the Women's Health Initiative have gone on to do further research and been like, without saying like, oopsies, there's, when you read the conclusions and the outcomes, like, oopsies, estradiol single-handedly does not cause cancer. That's not the problem. And in fact, in the Women's Health Initiative, in the ethinyl estradiol arm, so women only took that. They only took ethinyl estradiol. There was no increase in breast cancer risk. In fact, there was reduction. And they didn't publish that at all. What got out was estrogen causes cancer. And so 20 years later, and now when you read the statistics of the number of women who went off their hormones and subsequently the loss of bone health, brain health, heart health, and the chronicness of that and the outcomes of that, the cost of that to women, to family, to health insurances, having to go through that as opposed to staying on their hormone replacement therapy is astounding. The unfortunate outcomes it's led for women. Now, at the same time, through those years, when we're looking at estrogen, we were learning more about how does estrogen get processed in the body. And we were learning more about estrogen, estradiol in relation to progesterone. And what's like became popular is the phrase estrogen dominance. So not only do we have the fear around estrogen causes cancer, we then started associating PMS, tender breasts, weight gain, mood changes, heavy periods with this quote, estrogen dominance tagline that we were using. So the estrogen dominance tagline is just a short phrase for a much longer concept. When it's estradiol in relation to progesterone in the luteal phase of your cycle, and if it's off its railroad or it's a roller coaster track, or if it's going down the wrong pathway in detox, then it can cause some of these symptoms. But it's in relation to progesterone and how does it get cleared out of the body. That's a long sentence. And we all sort of just shorten it down to estrogen dominance. So now women are scared because they're like, well, I don't want cancer and I don't want PMS and heavy periods. So all in all, estrogen must be bad. And it's unfortunate.
Yeah. And I think most people do well when estrogen's moderate, I don't want to say moderate high, because I know high is perspective, right? But if estrogen's on the moderate to high end, but progesterone's also on that higher end too, like that's when people are like, they have great sex drive and their skin is great. I mean, they're like ready to rock it. They're living in their feminine energy.
Yes.
We always talk about it's so amazing how estrogen really is like our vitality, like living in our feminine energy hormone, just like testosterone is almost like the vitality and drive of men. Yeah. And I think the estrogen dominance issue is like it's like a rebirth of why estrogen can be so bad. And it's actually pesky little progesterone is just so sensitive. She just wants to hide every chance she gets.
And progesterone is very, all hormones. I love Mariah Carey, when we're recording this heading up to the holiday season. So I'm all excited for Mariah's Christmas songs. But like, she's dramatic, right? Like she's a diva, she's queen, and your hormones are the same way. Your hormones are very dramatic. They're very diva. They react to everything. Progesterone, especially, your body is not going to ovulate and your body is not going to release progesterone if your reproduction is in some sort of fear state, whether you want a baby or not. I don't care. I don't want a baby, but my brain is always scanning for, is she safe enough? Nutriented enough, like healthy enough to have a baby? And if not, then I may not ovulate, or I may ovulate but not produce very copious amounts of progesterone. We should be making milligram amounts of progesterone and microgram amounts of estradiol. And that gets, sort of forgotten and lost when you see the pictures and the books. And for those who aren't quite sure, milligrams is a lot more than micrograms. Micros, much smaller. And so when you don't pump out a lot of progesterone, when you don't ovulate and that level drops, but estrogen, even if it just stays what it's supposed to do, it's like following the rules, following the track, you still get this mismatch between the two hormones, and suddenly your period's heavier. Suddenly your boobs hurt, right? Suddenly you've got this PMS, etc., because of this mismatch. And that's just looking at those two hormones. That's not even including hormones that kind of look like estrogen out in our environment, or chemicals that are adding to the problem. I mean, it's a way more complicated conversation than just estrogen by itself is bad. I'm like, it's not bad. It's not, but it does have a lot of confounding factors that can screw things up.
Can you explain a couple of the different ways of how estrogen, I know we kind of talked about not detoxifying, of how estrogen can almost become bound up inside of the body?
When anything you eat, breathe, drink, swallow, you got to get rid of at some point. I mean, hopefully. I mean, obviously we have like forever chemicals, unfortunately, but your own hormones go through a detoxification process every second of every day. So you will see things online like, oh, here's my 3-day estrogen cleanse or my 7-day estrogen cleanse. And sometimes women are like, yeah, 7 days, I'll get rid of my estrogen. I'm like, no, that's a daily thing. Like you process it every single day. And it's a 2, if not 3-step process. And if any of that process is messed up, so think of like taking the trash out in your house when it's garbage day. You have to pack up your trash, like you have to tie it up in the bag. You have to move it to the outside to your trash can. You have to take the trash can like to the street, or you have to at least get it in the bin before, like if it's a community trash thing. It's a multi-step process. And if at any point something gets in the way, you don't tie the bag closed all the way. You only get it to your front door. You take it outside, but don't put it in the trash can. Somebody brings it back into the house. The trash truck doesn't show up. It's going to affect you don't want trash in your house. After a while, it smells and stinks and it's a problem. It's the same in your body. So if estrogen can't go down these different steps of detoxification, and or if it's going down a pathway that's maybe more what we call carcinogenic or cancer potential, DNA damaging, then that's when we also get into risk of the development of cancer or estrogenic type symptoms like we were talking about, PMS, tender breasts, heavy periods. And so not only is it about how you make estrogen, but like how does your body clear it, and we want to get the trash all the way out of the house to the street so the truck can pick it up and take it away.
Yeah. Can you explain a little bit for our listeners of, I know we're not going to dive into obviously like xenoestrogens, but just a little just give us a Carrie Jones breakdown of how we can become exposed to estrogens from plastics, coffee cups, from those things, and how that can play such a big role, especially because I'm a Seattle girl, you're Portland, the Pacific Northwest is about their coffee.
Oh my gosh.
Every time I see someone drinking out of one, I'm like,
holiday candle season as well.
Yeah.
Oh my gosh. Yes, absolutely. So these chemicals are estrogenic. They're endocrine disrupting chemicals. So estrogen, progesterone, testosterone, cortisol, they all fall under the endocrine system of the body. And we don't want to disrupt the endocrine system of the body. And these are endocrine disrupting chemicals. So the estrogenic type chemicals, your plastics, your parabens, your phthalates, your fragrance, and I'm saying these words because you're going to look at your shampoo bottle and you may see like phthalate free, fragrance free, like paraben free. They're saying this because they want you to know we've taken these endocrine disrupting chemicals out and hopefully you're not exposed. Why are they important? Because they look kind of like estrogen. So that means they can kind of bind to the estrogen receptor. It's like the key to your front door should just fit 1-to-1. You have one key to your front door, you unlock your front door and go in. But what if your neighbor's key kind of fits and the door unlocked? You don't want your neighbor coming into your house, but the key kind of works, it kind of fits, and the lock's like, yeah, good enough for me. I'll just go ahead and do the thing. And all of a sudden you have all these people in your home with kind of keys that you really don't want. It's the same in the body. When you drink out of those plastic lined to-go coffee cups with the plastic lid on top, a hot beverage, when you cook with saran wrap, when you reheat things in plastic, when you are burning, candles that are releasing fragrance into the air that you, your family, your pets are now breathing in, et cetera, then you are introducing those endocrine chemicals into your body. Now, hopefully, your liver is able to process them and get rid of them. But if it's not, for various reasons, then you're going to feel estrogenic, and it may have nothing to do with your own hormone and everything to do with the fact that these estrogenic type chemicals are turning the lock and opening the door. So you may have heavy periods, not because of your own estrogen, but because of the chemicals you're around. You may have tender boobs, not because of your own estrogen, but because every single day you're burning your pumpkin spice candle and putting pumpkin spice lotion on as you drink out of your to-go cup and reheat in plastic, et cetera, et cetera. And I'm not saying it's fair. I'm not saying it's fun. I'm not saying it's, like, I get it, but also like, we can save our body.
I know. I just wanted to when we're talking about fragrance, this was something I didn't get into like later in life too. It's like, it's the ingredients that actually says fragrance on there.
Yeah.
And it's not, so if it says like rose petal,
lavender oil,
like if it has a fragrance, it's not bad. It's the ingredients fragrance. And it's in so many things. And it's funny because even like the other day, my boyfriend bought a bunch of Epsom salts, and bless his heart, he's like, I got this one and that one and this one, these for you. I'm about my baths, right? Lymphatic drainage, like we love a bath. And all of them were like fragrance and Epsom salts, fragrance and Epsom salts. And I was trying to explain to him, like, this is a chemical, and then we're just going to sit in there in the warmth, and it's just going to absorb into our body. And it's just so toxic, and he's like, obviously whenever he does it, he's like, oh, I thought I was trying to do good.
I know. And it's
so
sad,
when you see it, but
I will say,
it's in everything.
Sometimes in some companies, I will see fragrance and they will shorten, like they will explain it, but you do have to do that bit of research. You'll see fragrance and you'll freak out and you'll go to the company website and they will actually say, it's a combination of these essential oils, but it won't fit on the bottle. The label's too short. So the FDA or whoever requires them to just put it under fragrance. But that's like extra steps you have to go through to be like, oh my gosh, I thought this was a healthy company. I'm going to go look up fragrance. But if the company's not that kind of company, they're not claiming to be a health company, it's clearly the detergent covered in fragrance that, they're not looking to be a clean company. It's that kind of fragrance. And I didn't know this either. I learned this. Unscented is a fragrance. So in traditional, let's say not a clean company, but like unscented detergent is scented and they add chemicals into it to cover up the scent. I didn't know that. So a lot of people think they're buying traditional big box brands and they're like, well, I'm good, it's unscented, not realizing it could be a cover up to the scent that's already a part of it. So you have the scent and a chemical to cover the scent. And I was like, wow, to be a chemical scientist, like talk about crazy and also ew.
Yeah, there's a website, it's EWG Skin Deep, and it's really cool because you can type in like your beauty product, like bare minerals or hemps, and you can see just how toxic they are. And it was actually really surprising to me to know that some were pretty safe and that others I were using, even though marketed as fairly safe, did have a lot of these ingredients in them that were kind of like endocrine disruptors. So they can also have other, it's not always about estrogen. There's other factors, other message receptors they can block. But I thought it was really cool because it takes 2 minutes to take your beauty products and just put that in there. And you don't have to go throw everything away. I always just tell my clients, the next time you're out of your, foundation, pick one of these. You don't have to just drastically overhaul your life. But if we could just do a little bit better every day, we would be in a better position when we're 40, 50, 60, 70. So it's just something to think about.
And it makes a big impact over time. And I have been doing the cleanup since 1999, and we're recording this in 2023. So I tell people, if you're on the first chapter, like I'm on the 24th chapter and I'm still not perfect. I was just talking with a functional dentist friend of mine, Dr. Stacy Whitman, and we were both like, we do the best we can with what we've got. And some people will go, do you drink out of a to-go coffee cup? I don't drink coffee, but tea. And I'm like, yes, sometimes. Sometimes in the airport. And I'm like, for sure, I do take the lid off. I am that girl. But I know it's plastic lined. And, I do the best I can. Most of the time I don't. Or if I'm not perfect. Not all of my makeup is 100% scores the highest on the environmental working group or Skin Deep. Most of it does. But like my eyeliner, my liquid eyeliner, not that healthy. So when I wear it out on date night or something and I want the like cat eyes sharp enough to kill a man, like it's not healthy, but like the smudgy kohl I have on now, that is. So it's these trade-offs that I'm working over the years.
I think awareness.
Yeah.
And, besides like just kind of slowly switching those products, like what do you like to suggest to people as maybe like a top like 3 to 5 things they can do diet or lifestyle wise to kind of support that detox process?
Yes. So there is actually a great woman, a great site, Environmental Toxins Nerd, Sarah Adler, and she's taught me a lot around, because we go for like budget, we're going for budget. And I tell people it's free to take your shoes off when you go in your house. Take it as best as you can, take your shoes off before or leave them in the foyer or by the door, and don't track everything you just walk through the day. Like low budget doesn't cost a lot of money. I do exactly what you said, Sonia. I tell people, when you run out of deodorant, find something cleaner. When you run out of detergent, like just slowly make the list as you go through it. People will freak out. Do I need a new mattress? Do I need a clean mattress? I'm like, no, I didn't get a new mattress until like way late in the game. I was going through everything else first. Filtering water as you can. There's obviously very high-end filters and there's very basic filters, whatever fits in your budget. Even a little bit of filtering is great. Same for like a shower head filter. With baths, when you sit in the heat or when you take a hot shower, if you haven't switched out some of your products yet, shampoo, conditioner, body soap, etc., all the pores are open, you're just putting that on. Or if you're sitting in the fragranced bath from Bed Bath & Beyond, and then all the pores have opened and you're just absorbing that, like think about that. So start to shift those things, and then when budget allows, maybe start to look into some of the filters. Clean air, open the windows, open the doors here and there, get your house to air out. When it fits in the budget, then consider doing some of the filters, like the room filters. Change your HVAC filter. Do you know how many people I talk to that, especially women, we weren't taught that to change an HVAC filter in our house. Even if you're renting, a lot of times you have access to it. Change your filter quarterly. Set a reminder. I have so many women that were like, I haven't changed it in like years. I'm like, oh my gosh, that's floating through your house, and you're breathing that. Yeah, absolutely. And then honestly, it's eat organic when you can. And there's a lot of hate and there's a lot of controversy around this. Here's my position on it, and I get it from Kiran Krishnan. He is the co-founder of Microbiome Labs. Kiran's like, when you look at chemicals, preservatives, food coloring, anything, food sprays, pesticides, they check it on the cell. Like the FDA requires them, like, is this going to kill a person? Is this going to kill a cell? And then, then they move into people, animal studies, and they move to people studies, and then hopefully it gets approved. Kiran goes, they don't check it on the microbiome. So when you're eating sprayed foods, sure, it's not going to kill you. But what I don't want to do is kill your microbiome, which is your first line defense to anything you eat, breathe, drink, or swallow. So if you could eat organic when you can, as it makes sense and fits in your budget, I get it. This is not going to kill you, and people argue that, but I'm trying to protect your microbiome. And your microbiome is a big source of your immune system. And it's a big source of your hormones. And it's a big source of your neurotransmitters. And it's a big source of, believe it or not, where you make a lot of vitamins, B vitamins, vitamin K, etc. And I don't want to screw that up. And it gets screwed up on its own through a lot of stuff we do. And it changes when we go into menopause. The loss of estradiol negatively impacts our microbiome. So if we can preserve the gut cells, which I realize is not being studied in these things, by eating organic when we can, like these little steps can, like in changing our thinking of, well, the FDA said it's fine. I'm like, but we don't test the gut cells. I'm trying to protect that barrier, that entry, right? So that's what I do.
Yeah, it doesn't kill us, but
right?
It's leaky gut, and
it surely doesn't make you stronger. So.
yeah, it's definitely like it's funny because when you said that, I thought, wow, there's so many people that just have such a passionate mindset around the whole organic or non-organic thing. And I think it's just about, I always try to tell my clients, it doesn't need to be an argument between you and your husband. Like most of them do this because that's kind of what it comes down to, is we don't need to do this. It's a budget thing. But when it comes to like a fertility case and you're trying to get pregnant and you're just wondering why, it's like, there are these things that are safe, but they also possible roadblocks for you of why, fertility hasn't been your lucky draw, or what you or your husband, or why, you can't seem to get rid of this PCOS coming back and you're out of it and then it's back again. Like there's a lot tied into the gut with a lot of these things.
Yeah.
Speaking of gut, can we talk a little bit about estrogen and the microbiome?
Yeah, absolutely. So
Mhm.
it goes both ways. So estradiol has a big impact on how your microbiome functions. Please keep in mind, you are more microbe than you are human. We have more microbes. We have to be very nice to our microbes. Otherwise they will band together, revolt, and make us feel terrible. So we have to be really nice to them. So our estradiol plays a big role on what our microbiome looks like, how our immune system acts, etc. But on the flip side, our microbiome helps us properly clear out estrogen when we're done with it. So when you're done with estrogen, just think of it like trash. You're done with an estrogen, you throw it in the trash, you tie the trash bag closed, and you throw it in your trash can, which is the equivalent of you're done with an estrogen, you throw it in a trash bag, and you run it through your intestines. You're going to poop it out. If your microbiome is not that healthy, it will release an enzyme called beta-glucuronidase. Its action are those of a pair of scissors. It will cut open the trash bag and it will let estrogen fly free, and you will reabsorb it back into your body, which you probably don't want. It's in the trash for a reason. And this unhealthy microbiome can now cause you to absorb all this estrogen back in your system. Again, heavy periods, tender breasts, PMS, worse endometriosis, etc., related to your gut. And so by helping the gut, in a lot of cases when people say, Carrie, they're very hormonal, should I work on their hormones or should I work on their gut? From a budget perspective, where would you start? I'm like, gut, hands down, always. Because everything filters through the liver and gut. And if you can get that rock solid, a lot of times the hormones get so much better because of that processing issue. So we want to take care of our gut for that reason.
I want to be thoughtful of your time, but I wanted to ask, when we were talking about our conversation about estradiol and the importance of it, kind of a two-part question here, but I don't want to get too deep into birth control. But
yeah.
for those women that are taking a birth control and they say it's low dose estrogen and they're thinking that we're getting that protection, and perhaps they're utilizing that in through perimenopause into menopause, are they truly getting the benefits that you laid out so awesomely when it comes to estradiol? Or are we kind of missing the mark when using a birth control as our hormonal kind of savior?
So when it comes to hormone replacement therapy, which we now are switching and calling it sort of menopause replacement therapy, when you're of the menopausal age, you want what's missing or decreasing in your system. And the reason I say that is the birth control pill was designed for women much younger. For sure, women in perimenopause take it, but it was designed for birth control reasons for women, in the teens and 20s. It also comes with a host of side effects. Now, I am not against birth control. I'm glad we have the option. What I do wish we had was a lot more education versus go on the pill. Everybody does. It's totally safe. All your friends are probably on it. You'll be fine. When we know that birth control has negative impacts on the microbiome, right? Like on our hormones, on, risks, other risks, we have mood, weight gain. And so women coming into perimenopause on the birth control pill, I'm like, how long have you been on it? And how is it affecting your neurotransmitters? How has it been affecting your gut health? We know that women, as they come into perimenopause and menopause, unfortunately, because of the hormone shifts, there's a whole cascade of reasons. They tend to gain more of that visceral fat, and the birth control, being mildly inflammatory to a lot of women, may not be helpful in that at all. So when we take a risk benefit, I'm not there. I can't justify it. If you need it for birth control in your teens and 20s, and that's what you're using it for, fine. I'm just going to educate you on it, and I'm going to help you replace the nutrients that depletes, because it can deplete a lot of nutrients. But by the time you hit that perimenopausal standpoint, I'm going to say, look, we need to start making this transition into maybe more of a menopausal hormone therapy, something that looks like exactly what's in your body, and then clean up some of the issues that might have happened because of the birth control, depending how long you've been on it. I will say there's a lot of mixed opinions on the birth control in perimenopause out there. That's what I tend to do with my patients, though, or when I consult. when they come in on the birth control pill.
For the female that says that she's on birth control, but it's low dose estrogen, can you maybe explain the difference between perhaps the estrogen that you're getting from a birth control as opposed to one, what your body's making naturally, and then maybe something else later on once estradiol might be something that would be prescribed?
So the birth control pill is set up, usually it's ethinyl estradiol, which is the estrogen that was used in that WHI trial. And it's usually some sort of progestin, which is the synthetic progesterone that may or may not act kind of like progesterone. It fits in the receptors and can turn them on, and or it can be more androgenic. So it's not actually very progesterone-like, it's more testosterone-like. And so when they say, oh, I'm on this low dose of estrogen, I'm like, but is it enough to protect your brain, protect your bones, protect your heart, given the synthetic nature of it and the known potential side effects of it? I actually don't know. I don't know that studies have been done yet on perimenopausal, menopausal women to say low dose birth control pill is going to protect you from hip fracture. It's going to protect you from dementia. We barely have the dementia Alzheimer's research happening. One of the leading researchers, Dr. Mascani, like she's getting traction, but not in birth control. She's looking more at menopausal hormone therapy and other lifestyle factors. So I wouldn't be able to say like, yeah, go on low dose birth control, and you're gonna sail through menopause. It's gonna protect you from everything. It's like, I don't think so. I don't know. We're not there.
You'd be better working on stress and inflammation, liver detox.
That's the thing. Like when you go into perimenopause, I want you to realize like everything changes on the inside, even though maybe you didn't change anything on the outside. That drop in estradiol and progesterone absolutely like raises your inflammation. It changes your visceral fat for the worse. It changes where you deposit that visceral fat. It negatively impacts your brain. It negatively impacts your cardiovascular system. Like it negatively impacts your microbiome. Things we know the birth control could already potentially put you at risk for. Like if we know you're going to be inflamed, why would I keep you on the pill knowing it's mild inflammatory? If we already know the microbiome is going to shift for the worse unless we do something about it, why would I keep you on the birth control knowing the risk on the microbiome? If I know the birth control depletes a wide variety of nutrients, B vitamins, vitamin E, vitamin C, it's almost a multivitamins amount or a length of how many. And then you go into perimenopause, which is a depleting state as it is. Why would I do that? And so again, risk benefit, trying to do no harm. And I don't think the birth control pill is a great option. I understand why they're on it. I understand why they're on it, but I'm trying to when you eventually do go on it, it's like, I'm trying to make it not rough. I'm trying to make you thrive and be healthy and clear brain and healthy gut for as long as possible. So let's maybe look at other options.
Yeah.
Okay.
Yep.
I feel like I could just go on forever and listen to, okay, let's talk about this now. You know,
I know female physiology is so fun because we don't get taught it. Like, truth be told, it's almost like we need a refresher class every decade of like, here's what's going to happen. Here are the changes. Like, here's what you should expect. This is important. I do get asked to speak, since we're talking about estrogen. I absolutely have women that will say, you know, do I have to, or are there risk factors for it? You don't have to do anything. It's your body. You can choose absolutely not to. And the risk factors are not the risk factors that we used to think. We used to think like if grandma had breast cancer, like, oh my gosh, you can't have estrogen. And that's long been debunked. If you do have a strong genetic BRCA, you know, you have a strong, like all the women in your family have developed breast cancer. Obviously, they're going to look at that as like, maybe you shouldn't do estrogen and is part of your menopausal hormone therapy. But it is nice to know that the tide is turning on how important estradiol is in all parts of the female body. And we know the amount of chronic disease, we know the amount of metabolic disease, so diabetes and heart disease, and et cetera, obesity increases, especially as we get older. And if we can do the foundational work and include appropriate levels of hormone, estradiol, progesterone, et cetera, with it, could we lower that risk? Can we really thrive into menopause? Because we're going to spend half to a third of our life in menopause, depending on your longevity. And I'm going for like healthy longevity. You know, I want to be traveling and doing all the things when I'm old. And my family lives a long time. So I'm like, I don't want broken bones and wheelchairs, and I want to be active. And that's what I'm trying to impart and educate on people who say, well, I never took hormone, I'm fine. I'm like, except you're not. You're not. That's why you're here talking to me, because you don't feel well, you don't look well, everything's off. It's something to consider.
I think some people don't, you know, when they think that they breeze through it, I think that conversation does need to change, because I think that people think breezing through it is not having hot flashes or night sweats. And number one, what I always try to talk to my clients about is, if you are symptomatic, you are symptomatic, and let's take a big step back on what is actually happening in your body to cause those. And then those that are like, oh, I breeze through it, you know, I'm not symptomatic. Number one, like, you know, are we having like a little bit of a halo effect, as far as like when you were mentioning estrogen can be produced in other areas other than the ovaries? So if we're looking at adipose tissue, so what is actually healthy for you? And then unfortunately, sometimes the symptom is a heart attack, right?
Yes.
Like, wouldn't we hate that to be your symptom? You don't have hot flashes, you don't have night sweats. Awesome. Your symptom is actually a heart attack, or perhaps Alzheimer's or dementia. And not saying that, you know, estradiol cures these things. We're not saying that, but I think that we're learning more each day, and we can see the benefits of maintaining a hormonal profile, and what happens just with females when they cross that threshold of having low hormones. And this is menopausal females. So if you're crossing the threshold into menopause, and automatically your cardiovascular disease risk goes up higher than that of a man, what is that saying for our females who are in their teens and 20s, and they have suppressed hormones then, and they're staying there, their teens, their 20s, you know, as Sarah was saying earlier, you know, I don't have a period. Awesome. And then by the time you're in your 30s and 40s, like, I mean, we can, you know, talk about like the mental health component. I think that's where that conversation needs to change. Like, it's not about making it past menopause and talking about it. It's about what's happening in your teens and 20s, so we can make, you know, your 30s and 40s and 50s like that much healthier and that much better.
I love that you said that hot flashes and night sweats may not be the only symptom, but that's what all women associate with it. I had a conversation recently, I've had it twice, where I've talked to two different women, and they said, I sailed through menopause. I breezed through menopause. I didn't have a single hot flash. I didn't have a single night sweat. And one day my periods stopped and never came back. I didn't have the wonkiness of my periods. Those were like, I did great in menopause. In both cases, both women had raging metabolic syndrome, very obese, high blood pressure, on statin medication, pre-diabetic, you know, like their doctors were kind of concerned, a lot of joint pain. So they weren't having the hot flashes and night sweats, and their period just stopped to them, because the society says menopause is just hot flashes. And I'm looking at them going, you have all the other symptoms that don't get talked about.
Yeah.
You did not sail through menopause. You're sitting in my office feeling like a train wreck, but proud of yourself that you never had hot flashes. I am very proud you didn't have hot flashes. Nobody wants a hot flash, but nobody wants metabolic syndrome either. Nobody wants to be on high blood pressure meds and statin medications, be pre-diabetic, and have all their joints hurt. That's not sailing through menopause. And I think by like you guys doing all this education and all the education we can do out there for women to be like, oh man, okay, I need to take this really seriously, because there's so much we can do for metabolic, for blood pressure, for cholesterol, right? Like the foundational work. Yes, the foundational work. I'm like, why don't we talk about this every decade? Why don't we talk about the foundations in middle school and high school? You may not remember it or like listen, because all you care about, you know, when you're 16 or 17, like that's like, what the heck? This is weird and gross. But nowadays with social media, so many women are remembering it, or they're also talking about it on social, or they're looking back going, oh yeah, I learned that in class about this foundational, how do I take care of myself? I'm seeing it younger and younger, you know, especially with coaches. Like getting better sleep and eating and movement and mental health. And I'm so glad and I'm so proud because we didn't have that even 10, 15, 20 years ago. And look at us now.
Yeah. Wouldn't it be cool? You were mentioning earlier, none of us on this podcast are anti-birth control. We're all very open about our hormone journals, and wouldn't it be awesome that, yes, if this was an option for a female and it was the appropriate option for her in her situation, whether that's a medical decision or a personal decision, wouldn't it be cool if we had follow-ups, like actual schedule mental health follow-ups? Awesome. We're going to put you on this birth control. Maybe it's literally just for the reason, I don't want to have babies.
Yeah.
Okay, awesome. So let's follow up with you in 6 months. Let's just ask about, hey, are you having a cycle? How, are you pooping daily?
Yeah.
Is it diarrhea daily, or is it like actual solid poop? How's your mental health? Maybe check in with the parents. How is she doing? Has anything changed? Like, I think starting that then, it'd be really cool to see, like, I don't know, long study, like how would that metabolic change happen over the lifetime? And then maybe even having the discussion around 20 years old or whatnot and say, hey, you've been on this a while. Let's talk again, because maybe your stance has changed in regard to what you want your future to look like. Let's do a touch base point,
Yeah. I mean, why don't pharmacies put all women on a quality multivitamin, knowing, this is well known in the literature, what the birth control pills deplete in our body. And so to my pharmacy friends, I'm like, why don't you recommend a multivitamin? Why don't you point them in the direction of a multivitamin? Why is this not common knowledge? I mean, even B12 is one of the things the birth control depletes is B12. Well, B12 plays a huge role in the body. B6, huge role in the body.
Maybe screen her for these deficiencies.
Yes.
So much.
Do like a couple stack. Here's your birth control, but here's your multivitamin. There you go.
There was a startup that was looking to do that. I unfortunately sort of lost track of them a couple of years ago, but I was like, it was a pharmacist who was frustrated and saw this and was like, we know certain medications, metformin depletes like B12. Why are we not giving back the nutrient we know the med is going to deplete? You absolutely might have to have this medication. I'm not debating that at all. But what I am saying is let's just deplete the thing we know is going to, or replete what it's going to deplete, and help people so much more versus letting them suffer, pill included.
It's not as sexy to market. I know we kind of talked about this earlier, but like ashwagandha is such a sexy item right now. It's in everything. And I love ashwagandha. I think maca's better if I had to stop together, but I love ashwagandha. But you'll never see B vitamins get marketed quite like ashwagandha, because ashwagandha is new and all this. But we know B vitamins play such a massive role in every function inside of the body, from mental health to fertility to like our cycle to longevity and autophagy. And it's like, it's so funny how it's just not sexy enough to market. I mean,
if it was a gummy and it said sex drive and it was a B vitamin, you get it.
That would sell.
Fly off the shelves.
Yes.
Exactly. Like zinc.
Gotta rebrand it.
With SEO, we got the SEO wrong on it. Yeah.
Every guy wants to be on like antlers of like deer antlers, and it's like, how about a little zinc?
Yeah. Or a lot of zinc.
Yeah. Go to bed.
Yeah. A little boron. Yeah. Go to bed. Stop gaming.
Exactly. It's not as sexy, but awesome. Thank you so much for coming on. This is kind of like a big bucket list item for all of us, where honestly, the amount of Carrie Jones webinars that 3 of us have watched.
I love it.
20 years of
my YouTube.
It might be a little excessive.
Yeah. I mean, like it's a lot. I mean, there's a lot. And it's funny because we joke about like even our significant others like know your voice because of all like the Dutch webinars we've done. And like, because obviously you were teaching on Dutch before Rupa, and obviously I get to experience you with MMU and Nutrition Dynamic, but it's just like 10 years of like Carrie Jones webinars. And if you want to learn more, I'm just going to say you're the easiest person to make complex situations understandable.
Thanks.
I like got it. When I had listened to so many webinars and then you explained like DNA damage and like the roof and the paneling. And I was like, oh, and I use that and people understand that. And I think all this information is like kind of useless if we can't explain it to people and spread the message and spread the word. So thank you so much for coming on today and just chatting estrogen with us.
Yeah, well, thanks for having me. I mean, I'm all about just ongoing supporting education because I want everyone freely to know this information. As we said, I wanted it in middle school. I wanted it in high school. I want it every decade.
Yeah, I know we want more. Where can people find more education resources, connect with you? Why don't you give us a little lowdown for our listeners of where they can learn more? Because you don't have a book, right?
Not yet. I know it's
Yeah,
one of the
say yet,
I know, not yet.
hopefully.
Come on.
I know, not
No
yet.
pressure.
Gotta add that to the next the next bucket list of things to do. So
Yeah.
Instagram, I'm at dr.carriejones. I'm dipping my toe in a TikTok for better for worse. Same thing, Dr. Carrie Jones. My website is drcarriejones.com. And then obviously for you like MMU, as you mentioned, is metabolicmentor.com, which I teach in there. And if you are listening to this, obviously see your fabulous coach because they can coach you through something like this. And I find a lot of perimenopausal women, because it's so new and they didn't change anything and everything's changing, to have that hand holding of a coach or somebody that gives more than 7 minutes. Maybe your primary care can only do about a 6-7 minute visit and they move on. But to really have somebody walk you through, hold your hand, explain, outline, that's the brass tacks that I need. Everyone needs as they're going through this big transition.
Thank you so much
Thank
again
you so
for coming
much.
on.